Hi folks, welcome to my channel, The Average Dermadoc. Let's begin the show. Hirsutism increased in terminal hair growth in a female in male pattern distribution, that is mainly over face. What is the reason? Excess androgens like testosterone and dihydrotestosterone. There may be increased production or reduction in sex hormone binding globulin, or hormones may be absolutely normal, but sensitivity of the hair follicles may have increased for normal androgens, or end organ metabolism like conversion of testosterone to dihydrotestosterone in hair follicles may have got enhanced. What are the clinical findings? Apart from hirsutism, because of this androgen excess, we can see signs of hyperandrogenism like acne, androgenetic alopecia, acanthosis nigricans, seborrheic dermatitis, and irregular menses. If the androgens got significantly high, it will lead to virilization of a female. That means female will develop characteristics of a male like deep voice, male patterned baldness, reduction in breast size, clitoromegaly, increased libido, amenorrhea, menstruation completely shutdowns. In hyperandrogenism, there will be irregular menses. In virilization, amenorrhea. Modified Ferriman Gallwey score uses 9 areas to assess the degree of hirsutism, like upper lip, chin, but it won't count the hair present in the sides of the face, that is nothing but side buns. In my full length video I have told it won't count beard, but that is side buns only. It will count some parts of the beard like chin, chest, upper arms, abdomen, pelvis, thighs, upper and lower back. So kindly correct that word. I have told it won't count beard, but it should be side buns. Each area after assessing is given a score in between 0 to 4 corresponding to hair density. If hair density is more, score will also be given more. After combining, the total score allows for overall diagnosis, like if it is less than 8, no hirsutism, it is normal. If it is more than 8, hirsutism is diagnosed, like mild, moderate, severe, very severe based on the score. Coming to evaluation and causes of hirsutism. First, we'll listen to the patient's story, that is nothing but history, and then we'll do physical examination. If we find excess hair all over the body, generalized fashion, that is nothing but hypertrichosis. If we find excess hair only on androgen dependent sites, it is hirsutism. Already we have studied in definition. Increased growth of terminal hair in male patterned distribution, that is nothing but this androgen dependent sites. Later we will ask first question, is menstrual cycles regular? If it is regular, hypothalamo-pituitary ovarian axis is perfectly functioning. That means entire endocrine system is okay. So no need to worry about endocrine problems. We will check for hyperandrogenism. We know what are the clinical features. We will see for it, and we will check in blood also the testosterone levels. That is biochemical hyperandrogenism. If testosterone levels are normal, there are no features of hyperandrogenism clinically also, then it is idiopathic hirsutism. That is no cause found. Everything is normal. If testosterone levels are found high when we do blood test, or when we see clinically hyperandrogenism features are present, then we will term it as idiopathic hyperandrogenism, because everything is perfect. There is regular menses, but hyperandrogenism is occurring. We don't know why. So we will call it as idiopathic hyperandrogenism with elevated testosterone. Now we will see what are the causes of hirsutism. When menstrual cycles are irregular, here comes the problem. We have to exclude so many causes. First we will ask for features of virilization. if present and the onset of hirsutism is also sudden, then we have to consider malignancy. Virilization will happen only if testosterone levels are very high, that is more than 200 nanogram per deciliter. We will do imaging studies to find out any mass like ovarian, pituitary and adrenal endocrine tumors. Next, neuroendocrine tumors like small cell lung cancer, carcinoid tumor and choriocarcinoma. All these will cause virilization. So we have to address these problems. How we will surgically remove tumors if present. There is no signs of virilization, just there is signs of hyperandrogenism. Hirsutism is also very slow in onset. That means androgens are increased, but not that level of to cause virilization. That is in between 100 to 200 nanogram per deciliter. Now we have to exclude one by one secondary causes. There in idiopathic hirsutism, no cause was found. Now here some cause is there for hirsutism. So that's why we are calling here this as secondary cause. And hyperandrogenism is also present. So these are called secondary causes with hyperandrogenism. Most commonly PCOS. Next, non-classical congenital adrenal hyperplasia, SAHA and Hayran syndrome. Next, we have to exclude secondary causes without hyperandrogenism like hyperprolactinemia, hypothyroidism, acromegaly, Cushing syndrome, pregnancy and drugs. If patient is taking externally these steroids, these androgens in the form of drugs, then also they will have a cause. That's why it is included here, secondary cause. Management, mainly lifestyle modifications. Mainstay of treatment remains that culprit, terminal hair removal. It is done by two types. One is temporary, which is self-administered by patient. Plucking, shaving, waxing, bleaching, depilatory creams. Another one is permanent, done by only experts like electrolysis and laser hair removal. Coming to pharmacological interventions, first drug we will give is OCPs only when the female is not planning to conceive. Anti-androgens like finasteride, flutamide, bicalutamide, spironolactone, cyproterone acetate. Glucocorticoids like prednisolone, dexamethasone. Gonadotropin releasing hormone analogs like leuprolide acetate. This is the final drug when everything got failed and features of hyperandrogenism is very high. It will inhibit the main first hormone LH and FSH so that androgen synthesis will be blocked. Metformin, ketoconazole. Ketoconazole is also an androgen antagonist. Topicals like eflornithine hydrochloride, which is ornithine decarboxylase inhibitor, and topical androgen antagonists like fluridil and topilutamide. Remember the channel name. Don't forget to like, share and subscribe. Thank you. Hasta la vista. До свидания.